Do all of your patients with lumbar spine degeneration require surgery? No. Do all your patients with a labral tear of the shoulder require surgery? No. It depends on the patient. It depends on the needs of the patient, the time restraints of the patient, the future goals of your patient. So when it comes to the labrum of the shoulder, we find as much degeneration in that in the asymptomatic population as we find in the symptomatic population. It's kind of like having a rotator cuff tear. Should we treat it conservatively first, or should we treat it with surgery first? Conservative first. In fact, the American College of Orthopedists say 6 to 12 weeks of rehab before you should even consider surgery. So what can we do as chiropractors to help our patients with confirmed labral tears? There are 4 things that I do in my practice that are supported by the literature. The first is work on joint mobility. As chiropractors, we are very good at working on joint mobility, but as it turns out, when it comes to the glenohumeral joint, there's a couple of ranges of motion that are lost. Most importantly, inferior glide of the glenohumeral joint to make sure it can clear that space, that subacromial space. The next piece is internal rotation. These patients, whether it's the cause or subsequent issue associated with a labral tear, they lose that internal rotation. Those are our posterior capsule muscles, our infraspinatus and our teres minor. That glenohumeral internal rotation deficit is limited on these patients, and we have stretches in office and also at home. They're going to help these patients. Check out Chiro for demonstrations, and also there's some demonstrations in this blog. The next is scapular stabilizers. We can make a dramatic impact on scapular strength. Can we do that in office? Or can we do that with at-home rehab? Usually at-home rehab is a choice of method for most chiropractors. There's some great exercise within the labral tear condition report within Chiro. And the last is working on core and working on mechanics. If you're looking for throwing mechanics, there's some great blogs in Chiro you can check out. But most importantly, can the person control their core in space? The condition report on lumbar spine instability is a great one to start if you're looking to help your patients out with core stability, especially when it comes to the shoulder. Remember, Ben Kilbrough said we need proximal stability for distal mobility. If we have problems with our spine, we're guaranteed going to have problems as we work out on the shoulder, elbow, and hand, especially with our overhead athletes. So check out the blog for all the nuances for this specific condition, but at the very end of the day, who should be treating labral tears? Chiropractors, because we take a global approach and we take conservative measures first. Are we going to help every single person with a labral tear and shoulder pain and loss of function? No, but we're going to help a big piece of that puzzle and help avoid surgery with our patients, which I think everyone would appreciate. Thanks for listening to this video, and make sure to read the entire blog for the 6 most common questions that you're going to receive in your office that both you and your patient can benefit from.